How's it going, everybody? Dr. Austin Quon here. I'm so grateful wherever you are in the world that you are tuning in to our spinal hygiene exercise video here. We're going to make sure that you understand how to do basic exercises that are going to help mobilize your spine, help lubricate those spinal joints. Very similar to the way that we brush our teeth. We want to make sure you're brushing and flossing your spine to make sure that we can add longevity to those spinal joints. This is going to be very adjunctive for a lot of the care that we're doing here at the office. So definitely make sure that you're doing these exercises. Just as a kind of overlying statement, most of these exercises it's for reps. We're not trying to build strength or muscles or anything really like that. It's really to just activate certain movement patterns that are going to allow us to add longevity to your spine. So I have Riley here. She's going to help me out with doing some of these exercises for us. But we're going to start off, there's specific exercises for your neck, and then ultimately specific exercises for your mid back and your low back, and even into your hips as well. So we're going to get started with the neck one. So Riley, we're going to start off with what we call the funky chicken. Okay. So what you're going to do is you're going to jut your head back, and you can kind of use your fingers to help you with that. So you're going to jut back. Imagine somebody's pulling a string through the top of your head. So you're coming back just like that, and then jut all the way out forwards. Good. Let's jut a little bit more back, just like that. Perfect. Okay, so all that motion is isolated right at the base of your skull. We want that motion moving very, very easily. Okay? Very good. Okay, so let's move on to the next one. So the next one we call these yes, no, and maybe so. So yes is neck flexion and extension. So rather you're going to tuck your chin to your chest as far as it'll go, and then extend your head all the way backwards nice and slowly. So it's not a race. We want to make sure you really try to feel that each segment in your spine is moving one after the other. Click, 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 and then going backwards the same way. It's a very rhythmic, smooth motion. All right, beautiful, Riley. So go ahead and tuck one more time for me. Beautiful. So again, if you can't initially get to that full range, that's okay. Eventually we'll build into you being able to do a full range of motion, flexion, and extension. Okay. So the next one we call it's no. So it's as if you're shaking your head no. So Riley, go ahead and twist your head all the way to the right. Good. And twist your head all the way to the left. Nice and slow. Good. And then go back to the right. So super, super easy. Again, very rhythmic. We want to make sure that each one of those bones is moving one at a time if we can. Okay, very good. So back to neutral, Riley. Then what we're going to do is maybe as if you tilted your head, maybe. So you're going to tilt your head to the side into lateral flexion. So go ahead and drop your ear to your shoulder, and then slowly, gently drop your ear to your other shoulder. Very good. Okay, back the other way. And back the other way. Very, very gentle, very easy. Okay, and again, these range of motions should be pain-free. So if you do have pain, let us know. We'll make sure that we can alter it for you. Now the next couple exercises is coupled motions. So we want to do skull flexion here. So Riley, you're going to jut your chin backwards like you're doing the funky chicken, and then you're going to tuck your chin to your chest. Beautiful. And then you're going to come back out of that flexion, and now you're going to jut your chin out into extension and extend the head back. And then back to neutral. Slowly unwind the motions you just did. So you want to trace yourself into the motion and then ultimately trace yourself back out of it. Okay, so jut up just like that. Good. So we go skull flexion, just like that, and then drop your head into skull flexion. Beautiful. All right, great job, Riley. Now, next one that you're going to do is you're going to tilt your ear to your shoulder, just like we did before, and you're going to look to that same side. Same side. There we go. Good. Okay, so back to neutral, just like that. Tip up. Now you're tilting to the left. Look to the left. Beautiful. So again, these exercises are honoring the normal coupled motion of your spine. A lot of people, when they're moving their neck around, they're not being very honoring to their system. So we want to make sure that people are doing motions and stretching their neck, moving their neck through biomechanically sound ranges of motion. So tilt to the side, look to the same side. So we call it ipsilateral lateral flexion, ipsilateral rotation. Okay, beautiful, Riley. That's good. All right, so wait right there. Next one. So that's the initial level 1 phase. So most of us that come into the office here, that's going to be a very basic introductory area. If you feel like you're a little bit more advanced, or we want to give you a little bit more to do, we start adding a few more motions into that sequence. So Riley, if you'll jut your chin back into skull flexion, just like that, and then tuck your chin to your chest, now we add a rotation component. So in that, go ahead and rotate your head all the way to the right, and rotate your head all the way to the left. Good. So we want to get that skull mobilized right in there. Okay, and then back to neutral, and always unwind your motion. Good. So you're going to jut your chin out now. Then extend your head back. Rotate left, rotate right as far as you can without pain. Come back this way. Good. Now, if you get dizzy, lightheaded, or fatigued, or feel like you're going to pass out or something like that, definitely stop. We'll make sure that we can adjust how we're doing this exercise for you. Okay? One more time, Riley. Tuck that chin. Rotate to the left. Rotate to the right. Oh, that's right. That's perfect. And then back up to the top. Good. Jut out one more time. Look up. Rotate to the right. Rotate to the left. Beautiful. Okay, cool. So, each one of those neck exercises we're going to try to do for at least 10 reps. And again, it's very, very slow and rhythmic. It's not like it's a race. We're not trying to build muscle. It's just to make sure that we're mobilizing those spinal joints again. Okay? So that's for the neck. Now, let's move on to the low back ones. Okay? So just in that same position you're in, we're going to do what's called kneeling cannonballs. So imagine somebody shooting a cannonball right through the center of your chest, and your body's going, whoo, just like that. Okay? So the key thing here is to make sure you keep your hands by your side the whole time. So that's the in, and then imagine somebody's hitting you opposite with a cannonball right in your back, all the way through, just like that. Beautiful. Okay, so we're going to do that. Again, we'll do each of these about 10 times, but the key thing is we really want to mobilize this mid-back area here, okay? By sitting on your knees, or excuse me, by kneeling or sitting in this type of position, you're really anchoring your lumbar spine down. A lot of that motion has to come from your mid-back, so it's super, super good. To mobilize that thoracic spine. All right, great job, Riley. So the next one here, these are very simple. Go ahead and you can go to like a prayer pose, put your hands right in the center, and what you'll do is you'll tilt into side bending. So you're going to tilt to the side as far as you can. Good, and gently tilt to the other side. Very good. And again, these are not very difficult exercises. It's just a matter of getting that motion into your spine. It's going to be healthy and hydrating to your spinal joints. So tilt to the side again, Riley. Beautiful. And back to neutral. All right, next one is easy rotation. So you're just going to twist to the side as far as you can. Good. And twist to the other side. Good. Just like that. That's beautiful. Okay. One more time to the right. And one more time to the left. Good. Okay, now we're going to couple some of these motions. So when the neck, your coupled motion pattern is ipsilateral lateral flexion and ipsilateral rotation. But in the low back, it's actually ipsilateral lateral flexion, but contralateral rotation. So we want to make sure that we're honoring that with our exercises. So what you're going to do, Riley, is you're going to tilt to the side, and then you're going to rotate through, just like that. Perfect. And then undo that for me. Okay, we'll do straight into the infinity side, but that's okay. So tilt, and then there, and then undo it. Perfect. Okay, and then you're going to tilt to this side, and rotate through, and then rotate back out of it. Perfect. Okay, so now the next thing that we can do is a very rhythmic infinity sign figure eight type pattern. So you'll rotate to the side, Riley, contralateral rotation, and then tilt all the way through, and then rotate yourself through. So it's almost like you're making this little figure eight shape with your body. Beautiful. Okay, let's get one more in there. This one feels really, really great. I like to do this one every day. It's really important to make sure that we get those low back joints moving. Okay. Beautiful. All right, next thing. So I'm going to have you turn to the side here a little bit, Riley, and face the wall there. So then this one is a very common yoga pose. We call it cat-cow or cat-camel. What we're going to do is make sure that we're drawing your mid-back up as high as it'll go and then dropping it through as low as it'll go. Okay? So drop it low, just like that, and then up. Perfect. And all the way down. Good. And all the way up. Beautiful. All right. So, very easy, right, Riley? Good. So the next one is an extended child's pose. So you're just going to be out in the child's pose. Make sure that you're nice and stretched out there. So it's a beautiful position there. Then the next thing is you're going to move gently into a cobra position where your low back is fully extended, your chin's nice and tall and extended. So we go from a fully flexed position to a fully extended posture. So we're going all the way down just like that. Very gently, you're going to roll upwards. And imagine, remember, segmentally, each bone is moving a little bit more than the one above or below it. Okay, just like that, Riley. One more time for me. All the way through. Beautiful. Okay, now, so go ahead and sit back onto your heels and get your hands right underneath your shoulders. So this is what we would call a reverse twist. So that we're really focusing on this one, on the rotational component in the thoracic spine here. So Riley, what you're going to do is you're going to put your hand on the back of your head. You're going to reach all the way down so your elbow touches your hand, and then you're going to rotate up as wide as you possibly can without letting your elbow bend, right there, just like that. So you should feel a lot of that rotation right in between your shoulder blades. Okay, so all the way down. Good, and all the way up. So obviously on this one, make sure that you do both arms 10 times each. Okay, so Riley, go ahead and switch arms for me. Good. So all of that motion we want to be coming from right in there, right in between the shoulder blades. Okay. You might even start cramping a little bit. That's very common. We're activating muscles that for a lot of people don't work very much and aren't very activated or strong. So we got to make sure that we can fire those up with a little bit of activation exercise. Okay. Great job, Riley. So now the last 4 that we're going to do, you're going to lie on your back. So again, these are mostly for your low back and for some of your hip motion. But what we're going to do here is you're going to keep your feet flat on the ground, arms flat on the ground. So you want to try to use just your lower half to make most of this motion happen. But what we're going to do is you're going to twist side to side. Keep your feet on the floor for this one, Riley. So you're going to tilt all the way to the right, just like that. So your knees touch the ground, and then you're going to come all the way back here. So you're doing it perfectly where your arms are staying just steady on the ground. All that motion is coming from the lower torso and all the way into the legs here. Okay? So it's all the way this way for me. Good. All the way back the other way. Good. Okay, so that's phase 1. Next thing is you're going to go knees up to 90 degrees, just like that. Then keep your feet together and you're going to do the same thing side to side. Just like that. So touch the knee and rotate all the way back to the other side. Beautiful. So it's a little harder now to keep your arms on the ground. So you want to make sure that you're trying to use your lower half as much as possible. You will want to make sure you're activating your core properly. If you have any questions about core activation, definitely check out our core exercise workshop that we have as well. All right, all the way rotated. Good. So that's knees at 90. Now you want to do knees as far as you can to your chest and keep continuing to roll all the way to the side, touch, and all the way to the other side. And touch. Beautiful. Okay, good. One more time, Riley, all the way to the side there. And bring it all the way here. So again, as you get closer to your face, it's going to be a lot harder to brace your core and keep your upper half locked down. Okay? Now, last thing, you're going to put your feet on the ground. So for this one, it's going to be a little bit more hip mobility. So you're going to go one leg at a time. You're going to open wide just like that. Perfect. And then stack your legs. And then it's almost like windshield wipers. So you're going to go all the way across with the other leg just like that. Okay? Perfect. Okay, so very rhythmic, very subtle. You want to lead with one leg and then trail very gently in a natural motion with the other leg. Okay, so rather let's go at knees up to 90, just like that, and then let's go one leg at a time. Beautiful. Good. And then knees all the way up to your chest. Let's see if you can do the same thing. Alright. One more time there. And that's good, lady. Okay, come on up for me, Riley. Great job here. Okay, so for these exercises, we want to make sure that ideally you're doing them every day. And again, this is what we would call spinal hygiene. We want to make sure that you're lubricating those spinal joints, making sure we're getting proper range of motion. As the chiropractor, we need to make sure that your bones are moving properly. But once you're out of the office and you're on your own, we need to make sure that you continue to keep those joints moving properly. So these are exercises that you can do every day. They're very safe, and again, they should be relatively pain-free. So if you do have pain at any point during these exercises, please discontinue and make sure that we can consult you on how we can alter the exercise to better fit your spinal needs. But again, thank you, Riley, and this is Dr. Quon signing off. Looking forward to seeing you guys here at the office.